Hi, my name is Michael Ranft. I'm a second-year student on the Northern College of Acupuncture's Master's degree in Chinese Herbal Medicine. So coming towards the end of the taught part of the course with our clinic portfolio to hand in the next couple of weeks, and then our final open book exam at the end of May. Then we start our dissertation phase a few weeks after that. It's been a fantastic journey so far. I've learned an immense amount of knowledge and gained a lot of experience in terms of deepening my understanding of Chinese medicine, as well as the myriad ways that we can use Chinese herbal medicine to treat often very complex conditions. So what's it like studying online with the NCA? There's a well-established structure online for teaching with the Northern College of Acupuncture. So our materials are all on a virtual learning environment, which we access via the internet. We can get our materials for all of our lectures. All of the assessment related information is on there as well. SharePoint is used as a means of structuring where to find that information on the system as well, and that makes life so much easier as a student trying to find what you need where you need it. There have been times as well where I've not been able to study from home if I've been away somewhere at the time, and I've logged into lectures and been able to contribute as normal from different locations. So that has been a real bonus of being able to study online as well. I've managed to make this fit with my life as well. There are times where I've been, stuck at a clinic where I'm working and I want to access materials. I can do that as part of this course as well. We use Teams for our lectures, Microsoft Teams, and the benefit of Teams is we can interact with the tutor as well during the lecture. So we can use all of the functions I'm sure you're aware of in terms of raise hand to ask question. We can use the chat function. Often that's a fantastic way of us being able to give our ideas if we don't want to break the flow of the presenter, or we don't want to talk over the top of each other. Putting it into the chat allows us to share information quite quickly and share our understanding. There's extensive use of breakout rooms in lectures as well, which has been really good because that allows us to work with our peers in smaller groups, looking at some quite complex cases or analysing a formula and working together to break down exactly what is that formula doing, why does it match these treatment principles that it's addressing. So that's been a fantastic feature of online teaching as well. Most of our lectures are recorded, which has been a huge benefit as it comes to revising and reviewing quite complex materials that we've covered. So having access to those recordings during the course of our study has been a huge help from a learning perspective. The big thing for me, the big positive of the course is the Herbs Clinic, the online teaching clinic. So with the clinic, we get to have a full day with that specific clinic supervisor, our little team of students who were in that day. Sometimes we've had students who've been in by themselves with the supervisor for the day, seeing all of the patients. I've been in on days where there's been 2 or 3 of us. We have a student who takes a lead on the case and takes the consultation, speaks to the patient again via Microsoft Teams, write your information up as we're talking. So it definitely has been beneficial in being able to multitask and keep on top of things that way. And then other students who are present in the clinic that day get to ask follow-up questions, as does the supervisor. And then patient signs off. We join a different room in Teams that is secure just for staff and students. And we then start to analyse and discuss the case, come up with our treatment principles, our strategy, and then what our prescription is going to be, all the while having the benefit and knowledge and experience of our clinic supervisor to direct us. And there's definitely been a staged approach to that learning experience. So it would begin in your early clinic days in year 1, more of an observer capacity, certainly asking questions of the patient, leading the discussion part of the consultation. But when it comes to the actual analysis and working out what we're going to do in terms of treatment and how we're going to treat what formulas are we going to use, that starts out as a very, very collaborative approach with the supervisor. Maybe, have a look at this formula. What do you think? Does this meet the needs of what our patient needs? All the way through to now, I've done 17 of my 20 clinic days of year 2, so I've got 3 more left to go. And now it's a case of every patient that we see, we get a little bit of quiet time to ourselves to come up with our own approach, come back to the group and say, well, I think the focus is this, and I think this would be the right base formula, these would be the right modifications, and then obviously we have a discussion before finally deciding what the patient actually gets. So that's been amazing in building confidence as a practitioner, knowing at the end of this 2-year taught part of the course, all being well, and passing all assessments, that we then get the postgraduate diploma to be able to get insurance and to treat patients using Chinese herbal medicine. So that aspect of clinic has been vital, absolutely vital, in improving my confidence within Chinese herbal medicine and how I'm going to use it to benefit my patients going forwards. The value of studying herbs to me as a practitioner, well, for me, it's always been part of my plan ever since doing my undergraduate degree in acupuncture. I really wanted to broaden my knowledge and have the whole picture, and not just do one element of Chinese medicine, but to have the triumvirate of acupuncture, Tuina, and Chinese herbal medicine as well. For me, it's about making sure that I can be of benefit to my patients no matter what they present with, within competence, within my competence levels and the boundaries of our clinical practice, but making sure that certain conditions that have proved more challenging to treat as an acupuncturist, specifically where we've got a lot of damp or phlegm or pronounced blood deficiency and the patient's reluctant to make dietary changes. These things during my acupuncture practice in the early days were, if only I had herbs to supplement this, and often I'd be sending my patients to herbal practitioners in order for them to benefit from that. I'm looking forward to being able to offer that service myself. Not only that, but the deepening of my knowledge of Chinese medicine has definitely been helped by this course immensely. I remember one of my tutors at college, when I was doing acupuncture, it talked about studying acupuncture as part of TCM, Chinese medicine in general. It gives us a map of ways to understand health in the human body, but sometimes that map is quite 2-dimensional. Herbal medicine makes it 3-dimensional, and it really has some of the more complex concepts that we were introduced to as part of the undergraduate acupuncture course. Now we've taken to a much deeper level in terms of understanding complex conditions, complex pathological mechanisms. All of that is it's filled in a lot of gaps in my mind. It's improved my confidence and understanding key aspects of Chinese medicine, and definitely, even just from a practitioner point of view as an acupuncturist, has already vastly improved my diagnostic skills. Tongue diagnosis, interestingly, is my skills within tongue diagnosis feel like they've taken a major leap. Obviously, one of the problems about doing the herbs consultations and appointments online is that we don't have the patient physically there to take their pulse, which is such an important part of Chinese medicine diagnosis. But instead, we've made more of tongue. So we get patients to send in photographs of their tongue, which we obviously crop for privacy purposes and data storage purposes. But the tongue photographs from different angles, sublingually, normal side view, all of those things, the level of detail we've been going into in terms of tongue diagnosis and analysis has been phenomenal, and again has had a huge impact upon my physical clinical practice with acupuncture as well, in terms of my confidence and accuracy within that. So I add that knowledge now to my already experience and knowledge of pulse diagnosis, and it's been amazing for my practice. I think one of the other things that really drove my decision to do the herbs course is the pandemic. You know, like I'm sure many physical therapy practitioners experienced when we were in lockdown in the UK here, and we couldn't practice. And that was a really scary time as a practitioner, because that felt like, well, is this going to be it now? How do I help my patients? I can't physically see them, even if I were to meet with them on Zoom, Teams, or FaceTime. Any of these ways of interacting digitally, but not in person. Acupuncture as a practice, it doesn't really lend itself to not being physically present with the patient, whereas obviously herbal medicine does, and certainly, God forbid anything were to happen again where we were unable to work in physical proximity with our patients. Now with Chinese medicine and essentially being taught telemedicine, being taught as part of this course how to effectively run a healthcare business via the internet or telephone calls to treat our patients, and using our prescription services to make sure that the patient gets the herbs that they need. It's been absolutely phenomenal, and it also does potentially open up avenues of being able to practice from different parts of the world within obviously the legal framework of the country you're prescribing in. So what are the standout features of the NCA Herbs course for me? Being able to spend study time with some phenomenal practitioners, not just our tutors and the clinic supervisors, who are all vastly experienced and an amazing knowledge of the subject, but some of our guest speakers as well, who we've had in guest lecturers on specific topics. It's been absolutely fantastic. I've really enjoyed being able to study in the way that the NCA course allows us to do it, in terms of I don't have travel to think about, which is fantastic. That's been a huge cost saving. I've been able to fit it in with my own existing busy clinic, and being able to work my clinic days for the herbs course, fit them seamlessly into my clinical working week. The lectures falling mostly on a Sunday, sometimes every other week, means I know that that's protected study time as well, and that's been brilliant. And having the e-learning sessions that we've got as well, which are pre-existing recorded sessions that then have specific reading material and questions that go with them, and then often a follow-up discussion tutorial session for an hour at a time that suits the students and the tutor. That's been fantastic as well. So I would highly recommend the course. I would highly recommend the Northern College of Acupuncture for that study as well. I felt supported, have felt like my needs as a student have been met. Any questions that I have had about course content, the practice of Chinese medicine, have all been answered fantastically. There's not been a moment where I've felt I'm not getting what I need from the course, and I'm really looking forward to being a practicing Chinese herbal medicine therapist as well as an acupuncturist. So yeah, highly recommended. And if you do the course, I'm sure you'll come away with the same positivity that I've got for it as well. Thank you.